A community health outreach which began in 2020 shortly after the COVID-19 pandemic has continued its mission of taking medical services directly to market traders who often lack the time and knowledge to prioritize their health. Let's now join Elizabeth Kasham for more on this.
Speaking during the outreach at Apple Mechanic Village to mark World Diabetes Day, medical practitioners who organized the outreach explained that the initiative was created to reach traders in their workplaces where long hours and pressure to make sales leave many unaware of the dangers of unhealthy lifestyles. They advised residents to ensure food safety while calling on government to invest and support diabetic sensitization, for that's the only medium to tackling the disease.
Therefore, my advice to the government is this: let us also start with subsidizing these meals that these people consume, because you're talking to people about how to eat healthy, and a lot of them are scared. Most of our meals are not accessible, and even if they are accessible, they are not affordable. Even if they are affordable, they are not safe. Because aside the fact that most of these meals now, you see them being grown with different artificial sweeteners, some of them say genetically modified foods. This is the fear we have. You buy banana, you don't know whether it's been ripened artificially, you don't know how it is being cut. You buy even our vegetables, you are afraid of what is coming out of it. So let our foods be safe.
The public needs to know that diabetes is actually a very serious situation. With the way life is now, our jobs and every single thing, we're usually sedentary. So something as simple as food can help in managing diabetes.
Residents who benefited from the free medical services commended the initiative, noting that the sensitization is essential in helping people understand the importance of adopting healthy habits.
It's a very welcome development, and it's well interesting for our people to be lectured on how to live their life, because this life have no spare life. So it's good for one to be lectured and tell you things you need to eat at the right time and things not to eat.
I've gotten to know that there are some food that you must also avoid, and that we have to impute and integrate a lot of food that has fiber on it. But for us to do away with diabetes, there are some certain kind of lifestyle which we need to do. And by coming closer to them, I've learned those things which I needed to know. That is the things that I get. At least I have to reduce my alcoholic intake.
According to the team lead, the program has visited several major markets, including Ruzzy in 2020 and Jabi in 2022, to sensitize traders and the rising burden of non-communicable diseases such as diabetes. They noted that many traders struggle with lifestyle addictions such as excessive drinking and smoking, which increase their risks of chronic illness. Bringing medical checks and expert counseling directly to their stalls, they said, could help to break barriers and encouraging them to seek professional care. Elizabeth Kasham, ASO Television News.